Alright, we're from Fort Erie, and we're here to say that closing down our hospital is the wrongest thing you could do.
Wrong.
We were all born here, we were all born there. Tearing it down would be like tearing down a part of us. That hospital's been there for us when we've needed it the most.
Most of us were all born there.
Yeah.
Yeah, he said that, but we've all had pretty bad injuries. Peck almost broke his neck.
Definitely.
I broke my hand and had to go there.
I got hit by a car.
I fell through a roof during the season. And we all went to the same hospital.
Pretty much if that hospital wasn't there, some of us might not be here. So save the hospital! Yeah!
Today, the Yellow Shirt Brigade of Fort Erie, with supporters across Niagara, are making our first segment of It Is Our Time, a time to save the Douglas Memorial Hospital from closure by the Niagara Health System and the LHIN. On September 27th, the emergency department is to be closed by the NHS and changed to an urgent care centre, which will treat minor ailments such as bumps, bruises, colds and flu, and other non-threatening medical problems. This change will leave nearly 40,000 people along the shoreline of the Niagara River and Lake Erie without access to immediate emergency services. The race today is the kickoff of our awareness campaign to show that our fight for equal rights as Canadians is in full swing. A fight for our lives and the lives of our children and grandchildren.
You can do it for all of us. It's your time and our time to win.
We will not quit until we break through the finish line and get our hospital back, defeating the government, the NHS, and the LHIN.
The day after, what protesters and politicians are saying about last night's hospital arrests. Good evening and thanks for joining us. There's plenty of fallout tonight over a massive protest last night outside Douglas Memorial Hospital in Fort Erie. 150 demonstrators gathered to rally against recent cuts, but as we first reported last night at 11, when one protester set fire to a homemade hospital sign, frustrations intensified and police stepped in.
It all started when the H on the sidewalk was lit up and burning.
What's unpeaceful about this? It's arson. Arson to my own property? Yes. You're on public property here. I'm on a private... You know what? Let's just make this real simple. You're under arrest for arson.
Arrest me, officer. Let's all be arrested.
Terry Nichols, the man who brought the H, says he intended to put the fire out when his confrontation with police escalated.
And I had no idea it was going to turn out the way it did. As far as I knew, most of the people there were middle-aged or older, really worried about the hospital going under, and it seemed to just go ballistic from there. And I thought maybe they would just say, this was a really stupid thing, get it out of here.
Nichols' friend Ted Dexter was arrested for obstruction. Dr. David Henry was then handcuffed, put in the back of a cruiser, and charged with mischief.
It was a little overzealous, I think. We maybe should raise some funds for sensitivity training for the policeman, but he had a job to do. I don't hold it against him.
If there's anything positive to come out of the arrests and charges against 3 people at last night's protest, it's that it shone a much brighter media spotlight on Fort Erie's efforts to keep their hospital open. Dr. Patricia Teal, Dr. Henry's wife, blames the McGuinty government and the Niagara Health System for the protest.
If they hadn't gone into our operating room on the very day they wanted to close it and taken away everything we have right in front of the nurses who work there, people would never have been this inflamed.
The frustration in this community will only build because the emergency department at Douglas Memorial is scheduled to close in September. Lauren Sabrin, CHCH News, Fort Erie.